Essentials Exam 3 Urinary and Bowel Elimination Nutrition Oxygenation Wound Care Nurse Educators Actual Exam Questions in Question 1. Elimination, Nutrition, Oxygenation, Wound Care, Nurse Educators, Actual, Correct and well detailed. What is the correct order for an ostomy pouch change? 1. Close the end of the pouch. 2. Measure the stoma. 3. Cut the hole in the wafer. 4. Press the pouch in place over the stoma. 5. Remove the old pouch. 6. Trace the correct measurement onto the back of the wafer. 7. Assess the stoma and the skin around it. 8. Cleanse and dry the peristomal skin. 5, 8, 2, 7, 3, 6, 4, 1. 8, 5, 6, 2, 7, 3, 4, 1. 8, 5, 7, 6, 2, 3, 4, 1. 5, 8, 7, 2, 6, 3, 4, 1. D. 5. Remove the old pouch. 8. Cleanse and dry the peristomal skin. 7. Assess the stoma and the skin around it. 2. Measure the stoma. 6. Trace the correct measurement onto the back of the wafer. 3. Cut the hole in the wafer. 4. Press the pouch in place over the stoma. 1. Close the end of the pouch. Question 2. The nurse should do which of the following when placing a bedpan under an immobilized patient? Lift the patient's hips off the bed and slide the bedpan under the patient. After positioning the patient on the bedpan, elevate the head of the bed to a 45-degree angle. Adjust the head of the bed so it is lower than the feet and use gentle but firm pressure to push the bedpan under the patient. Have the patient stand beside the bed and then have him or her sit on the bedpan on the edge of the bed. B. After positioning the patient on the bedpan, elevate the head of the bed to a 45-degree angle. Question 3. When a patient has fecal incontinence as a result of cognitive impairment, it may be helpful to teach caregivers to do which of the following interventions? Cleanse the skin with antibacterial soap and apply talcum powder to the buttocks. Use diapers and heavy padding on the bed. Initiate bowel or habit training program to promote continence. Help the patient to toilet once every hour. C. Initiate bowel or habit training program to promote continence. Question 4. A patient has not had a bowel movement for 4 days. Now she has nausea and severe cramping throughout her abdomen. On the basis of these findings, what should the nurse suspect? An intestinal obstruction, irritation of the intestinal mucosa, gastroenteritis, a fecal impaction. A. An intestinal obstruction. Question 5. The nurse is taking a health history of a newly admitted patient with a diagnosis of possible fecal impaction. Which of the following is the priority question to ask the patient or caregiver? Have you eaten more high-fiber foods lately? Are your bowel movements soft and formed? Have you experienced frequent, small liquid stools recently? Have you taken antibiotics recently? C. Have you experienced frequent, small liquid stools recently? Question 6. The nurse is caring for a patient with an ileostomy. Which intervention is most important? Cleansing the stoma with hot water, inserting a deodorant tablet in the stoma bag, selecting or cutting a pouch with an appropriate size stoma opening, wearing sterile gloves while caring for the stoma. C. Selecting or cutting a pouch with an appropriate size stoma opening. Question 7. An elderly patient comes to the hospital with a complaint of severe weakness and diarrhea for several days. Of the following problems, which is the most important to assess initially? Malnutrition, dehydration, skin breakdown, incontinence. B. Dehydration. Question 8. Match the following steps for administering a prepackaged enema with the correct order in which they occur. 1. Insert enema tip gently in the rectum. 2. Help patient to bathroom when he or she feels urge to defecate. 3. Position patient on side. 4. Perform hand hygiene and apply clean gloves. 5. Squeeze contents of container into rectum. 6. Explain procedure to the patient. 6, 3, 4, 1, 5, 2. 6, 4, 1, 3, 2, 5, 4, 6, 3, 1, 2, 5, 6, 4, 3, 1, 5, 2. D. 6. Explain procedure to the patient. 4. Perform hand hygiene and apply clean gloves. 3. Position patient on side. 1. Insert enema tip gently in the rectum. 5. Squeeze contents of container into rectum. 2. Help patient to bathroom when he or she feels urge to defecate. Question 9. Which of the following may cause Clostridium difficile infection? Select all that apply. Chronic laxative use. Contact with difficile bacteria. Overuse of antibiotics. B. Contact with C. Difficile bacteria. C. Overuse of antibiotics. Question 10. Which skills must a patient with a new colostomy be taught before discharge from the hospital? Select all that apply. How to change the pouch. How to empty the pouch. How to open and close the pouch. How to irrigate the colostomy. E. How to determine if the ostomy is healing appropriately. A. How to change the pouch. B. How to empty the pouch. C. How to open and close the pouch. E. How to determine if the ostomy is healing appropriately. Question 11. During the administration of a warm tap water enema, the patient complains of cramping, abdominal pain that he rates 6 out of 10. What is the first thing the nurse should do? Stop the instillation. Ask the patient to take deep breaths to decrease the pain. Add soap suds to the enema. Tell the patient to bear down as he would when having a bowel movement. A. Stop the instillation.